Thanks, Juliet. Okay, so we're just going to spend this last little bit of time now as we're heading towards the end of today's session. I suppose we've talked about this as a team, thinking about a funnel where we've heard lots of, things from like national and system wide, and bringing it together, as Wendy said, through the research and the conversations that we've had. And now this final bit of the session is to think about, well, actually, having heard all of this and talked about what we've talked about this morning, what are the resources that are already out there that can help and plan for measure for healthy cultures in a system? Can I have the next slide, please, Lindsay? Thank you. So why measure your culture? So when we were, obviously, as we were researching, but also as we were having conversations with people, we're thinking about, well, what are the specific reasons where we need to measure ICS culture? So having a look, diagnostically assessing it. So is the cultural alignment within each ICS, and having to think about where to focus any interventions. But I think the key thing here that we found was about being honest and establishing a baseline and looking at system maturity level about where are we right now. And the conversations that we found were that everyone is in a different place. We've got 42 ICSs across the country, and within those ICSs, organisations are going to be in different places as well. I think we have to accept that there might be some places where it is, an ICS is where we are kind of at a very, very starting point where there is very little knowledge about what is going on in an ICS, and then looking at what the different needs are at the different elements of each system. So are the variations, if we look at, as Wendy had mentioned, the language about looking at system and place and neighbourhood. So if we look at them, are the different needs at different levels in the system? Absolutely, there's going to be variations. Are the trends? And then measure the required behaviours of a distributive leadership model that will enable the collaboration and coordination of local service, and look for any dominant cultures. If you think about your ICSs where you sit, if you think about the organisations that we sit in there, and I seen there was a chat coming up around like voluntary sector. So we know of our NHS trusts, our local government, our voluntary sector, and the third sector. Are there any competing values or dominant cultures that will maybe forcing the way through to ICS level? And then the whole thing that we've picked up is talk about psychological safety and compassionate leadership. Is there the presence or absence of trust or respect? And then going back to Donella Meadows, how can we look, and when we measure our culture, how can we identify where the leverage points are? So if we think about leverage points, you've got process, you've got patterns, you've got the social and the mental models. Where are the leverage points in your system where you could maybe make a small change that will be a quick win? So Donella Meadows, and I think it's Jake Forrester, who's one of the systems thinking gurus, refers to them as, that in society we talk about them as a silver bullet or a miracle cure. So if you think about your ICS, and if you were wanting to shift it, what could be that one thing, that silver bullet, which would make that big change? Okay, next slide, please. So again, why measure your culture? What we want to also do, and we hear from people in conversations that we had, was that starting to measure and see what's out there and what people are doing well and where there's potential areas of development can give an opportunity that we could start looking at peer reviews. And I know NHSE, I've got an idea that actually it would be great to start looking at how we could have peer reviews across the whole country as well. And what's going well, I know we talk, I've seen in the chat as well, the silo working is fine, and absolutely there is needs for it. But sometimes there are things that go well. And I think from my experience working in my previous role, sometimes I'd have a ward, right, and I was doing something absolutely amazing. It was doing something fantastic. But the ward right next to it didn't know about what was going on. Okay. And it would help them, and nobody was hiding anything, but we just don't share things naturally. So how can we share what is going well? And how can we review the relationship between central, regional and local? So the idea with an ICS is that what we want to be doing is we want to be having a culture, a leadership culture that allows decisions to be made at a local level as much as is possible, but understand when there is a need to actually go up to regional and when there is a need then further to go to national. And then another thing that we found was there's and I think this has come up in the chat definitely today, is the effectiveness of partnership work and community power. So with organisations, and then but also actually our people that we serve, whether or not we're in health or voluntary sector or in local government as well. So we know that there's some good practices going on. It links to that second point, what's going well and how do we share these things? And again, we've seen this in chat today where people are sharing examples of what they're doing, and that's fantastic. And then it comes to metrics, isn't it? You know, we're used to metrics. I did 6 years in an OD role where I was used to reporting against the single and national oversight frameworks. And we know that, you know, what gets measured gets counted, but actually how are the other things that reflect local joint priorities that all members of the ICS, of each ICS agree on, that we can measure the successes there, and what does that look like? And then checking for alignment for a shared vision. How do we check whether or not people know what the vision of the ICS is? Do they feel bought into the vision of their ICS? Okay, next slide, please. So we've had these conversations, listened to lots of things, coming up with some ideas about what is it that we could potentially do to start to look at measuring the ICS. But at the end of the day, if we measure it and we get these results in whatever way it is, then that goes back to that Ralph's model of reflection, which is, well, okay, so what have we heard? So what are we going to do with it? And now what are going to be our actions? And those of you who come from an NHS background will be well aware of staff survey. You know, every year we do our NHS staff survey and we hear our results of our staff survey, and it can take us a bit of a while to get it out there. And by the time we get it out there, we're ready for our next staff survey again. So actually we need to start maybe going back to Danella Meadows' leverage points and looking at these maybe smaller things, these silver bullets, where we can start off, share the successes and go from there. And then, like, finally, just in this part of these slides is think about the fact that we need behavioural change. So consider the concept of COM-B model. So some of you will be aware of that if you're from a health background, that actually, you know, that's looking at capability, opportunity and motivation, ultimately the behaviour in the system. And that's what we're going to be looking at. And that's what we've talked about this morning. It will impact on how the culture is measured. So how we behave will not just impact on the culture, but it will impact on how we measure the culture. So our actions and how we do that, who we engage with, who we ask, the formats that we use, what actions are identified, how honest are we in the actions that we identify and the things that we need to do and the priorities that we need to take. And any implementation afterwards, where's the ownership? You know, is the joint ownership, is the collaboration across any priorities? So one thing that we realised that the research that we did and from our own experience is we know that there are various ways of measuring culture, and they're in lots and lots of different formats. And we'll finish off with this question at the end, but I want you to start thinking about it now. Just as I finish off my slides, what have you got in your systems available already? And when I talk about systems there, you might have something in your ICS, but you might not. You might have something in your trust, you might have something in your organisation that is there. And I think the key thing for me that we found, and Wendy and I found as we were having these conversations, is one size doesn't fit all. We've got 42 ICSs across the country, different makeups, different sizes, you know, formally different amounts of CCGs and trusts and things like that. So we know that one size doesn't fit all. What might work in one area is not necessarily going to work in the other area. But I still go back to that fact of, well, let's just share what we've got that's out there anyway, and let's just share what we're doing. Okay, next slide, please. So again, how do we measure each of these elements of culture? It's not exactly that straightforward. We're not, you know, we're not like counting beans, I suppose, when it comes to culture, but we need to think about how are we measuring what we see, how are we measuring what we hear, and how are we measuring beliefs and values and attitudes. Okay, so you know, if you've looked at NEOD, it's working. I know Juliet started off looking at an iceberg at the start, so looking at those things, so that's Shine's iceberg model there. But also, if we look at this model over there on the right hand side, this is saying for in system work, and we want to move to that 2 column, so where people have purpose and values, where people have got distributed decision making, where there's radical transparency there. How do we measure that? So just putting that one up there. So, you know, how do you see that? How do people feel that? How do they hear it? How would you measure it? Okay, next slide, please. And then how do we measure system energy? So I'm just keeping an eye on time because it goes quickly. But how do we measure that there are individual needs taken into consideration still in the system, that there is integration going on, that there is also, and I think someone mentioned silo working, and I do wonder whether or not it was this link in here around preserve and protect. What's going, you know, if you've got something going on in a specific area that worked well for years and years and years, there should be allowance to preserve and protect that, whilst also sharing it and spreading it wider. And then how do we allow and adapt any changes to come into place? Okay, next slide. So practically now, final steps to think about it. What do we need to do? What types of formats do we look at? You know, so there's, if you come from like a, you know, if you think CQC, Chloe's in the local government, so you've got that type of format where you could use it. We're used to surveys, like staff surveys, but also what type of format would we use? Who would we carry it out with? So would we use it everywhere? But we know some systems are huge, and Maria said before, there's 1.5 million people working in ICSs across the country. We need to listen to everyone, but we can't necessarily start everywhere, can we? So where might we pilot? Who's going to run it? Let's think practically. Who's going to run it? Have we got any teams? Have we got any, you know, groups in place who could run it for us? But then importantly, let's now start going to the so what and the now what. Where does the influence and the power for any action? So when we discover this, when we listen to people and we hear what we say, like we do in our staff surveys every year, then actually what do we do with it? And then let's think about any variations. Okay, next slide, please. So busy slide, but these are some of the resources out there that can help you measure new cultures, and different, you know, some of these have been knocking around for a long, long time. So we've got some good papers in there from the NHS, we've got local government papers in there, we've got a lovely collaborative leadership survey, which we found up there. And then looking at some models, so some team-based working models, some culture models like McKinsey's 7S's or the Wiseboard 6 model. And then also, of course, then you've got your NHS things, you've got your King's Fund Cultural Care Barometer and your staff survey. Next slide, please. So I did a matrix, and I went through these, and I'll give myself a bit of a disclaimer in a minute. And I looked at all of these resources against the themes that Wendy talked about before in the conversations that we had, and Maria's introduced around the CCPL framework. And I'm not going to talk through every single line there because you can see it yourself, but we've got differences. So, for example, that collaborative leadership model is a lovely survey, and it's got lots of really good things in there, but it's not ready to take off the shelf and use. Okay, so all of these, and I don't want to steal anyone's thunder at the end, but we've uploaded somewhere so that you've got access to them. So if you wanted to go in to have a look at them, next slide, please. But I think there's just a couple of things that I just want to finish on. One, the map, this concept, this NLP concept of the map is not the territory. And I talk about this from my worldview, which is an OD practitioner. These are the resources that I'm used to, and I worked in a trust previously. I work in the innovation agency now. So this is what I'm aware of, but it's not exactly the territory. There are other things out there. And I think it's also something to keep in mind when you are implementing and bringing any kind of resources and measurements into place, that you are coming at it from your worldview. And we've seen in the chat today, there are differences in opinion around language, there are differences in opinion around professional groups, that people are feeling more involved. So just keep that into consideration about your worldview, and that your map is not necessarily the territory there. Okay, next slide, please. And this is one of my final slides, and it's just a concept to bring in. You know, don't throw out what you've got already. If you've got a tool that can measure culture exists in somewhere, maybe it's not quite ready for ICS, maybe it works in your organisation, maybe it just needs tweaking. Maybe go and have a look at some of those papers or those resources that we've referenced there, and see if there's anything that you want to do to tweak it, to make it a little bit more relevant, to take it from organisation to system level. Okay, next slide, please. And finally, I think the thing is with this is have a go. You know, I have a mantra, which is done is better than perfect. Try something out, have a go, pick a pilot area, pick something that you want to use, a specific resource that you've maybe got already, tweak her a little bit, and have a go. And then have a look at what your results come back and see whether or not, does it fit? Do you need to tweak it, and do you need to do it again?